For my orthopedic exam, I start at the foot. I like to look in between the toes for any evidence of erythema or swelling. I like to look at the pads to see if there's any abnormal wear, looking for that elusive thorn, any swelling or redness. I like to check the toes for any scuffing. I flex and extend each of the digits individually and then together as a unit for evidence of pain, directly palpating over the joints of the phalanges to see if there's pain, which you'll see with sesamoid problems. Palpating up the metatarsal bones for any evidence of pain towards the tarsus. When I get to the tarsus, I like to flex and extend it to see if there's any crepitation. I like to palpate cranially to see if there's swelling. I like to palpate medial and lateral instability, both in flexion and extension, because there's two arms to those collateral ligaments. I like to palpate the calcaneus and the common calcanean tendon for any swelling or irregularity, palpating up the tibia and fibula for any evidence of pain. When I get to the stifle, I like to flex and extend the stifle with my hand over it to palpate if there's crepitation. Then I like to palpate the patella tendon, medial and lateral, to see if there's any loss of distinction, which we'll see with any effusion in the knee. Palpating for cranial drawer, see if I could luxate the patella, typically with the stifle and extension. Palpating for joint pain, distal femur pain, or proximal tibia pain, which you'll see with joint capsule tumors and bone tumors. Palpating up the caudal musculature of the thigh and the femur for any evidence of pain or masses. When I get to the hip, I like to take the hip through a full range of motion, extending the hip, internally rotating the hip, and abducting the hip, and taking it through flexion as well. Then I palpate up the lateral aspect of the pelvis for any evidence of pain or masses. I like to palpate the lumbosacral area for any evidence of pain as well. That's my orthopedic exam in 2 minutes.